Okay, everyone. Happy Friday. How are you, Mare?
I am doing awesome and I'm ready to talk about all the things.
We are going to kick off a little series, you guys, because we honestly have so much that we can jump off on this topic. And it's something that comes up a lot. It came up yesterday in our group mentorship and comes up all the time with consultations. And that is the topic of amenorrhea, fertility. And as we talk about extensively, amenorrhea, missing your period, fertility in general is so important, whether or not we have goals of getting pregnant in the future or not, because having healthy ovulatory cycles, having a regular period, which, if you want to learn more about what that entails, what that looks like, we have endless blog posts about it and free resources that you can download, including a menstrual cycle checklist. But back to the topic at hand, functional hypothalamic amenorrhea is what we are going to be talking about today. And just kind of introducing the topic because this is something that happens all the time post prep or in cases of chronic dieting is individuals who lose their cycle.
Yeah, something I just want to start off with is maybe near and dear to our hearts is this is something both of us have actually experienced personally. So this isn't something that we're just talking about. This is something that we have both experienced, we've struggled with, recovered with, and just kind of, gone back and forth. And it can be an ongoing thing for a lot of females. But I think making the tone that it is something that we do understand personally, I think is really important. And I think that both of us are in that place where now that we understand the implications of having amenorrhea, it really changes the game. Because I know for myself, when I had amenorrhea, number one, I didn't know it. I didn't know that it was a problem. I was not in the fitness space. I was in the dancer space. And for me, it was just inconvenient. Like I didn't care that I wasn't bleeding every month. I thought it was great. I remember actually bragging to my girlfriends that I had a period like once every 6 months. I was like, yeah, it's like maybe once every 6 months for like 2 weeks. I No one ever really talked to me about it. I truthfully didn't learn about, I think, that the importance of having a period was until I actually got into bodybuilding, which I think is interesting because most people talk about bodybuilding being like this negative cause of it. And I'm like, actually, it gave me a lot of education about it in a positive way.
I actually, same as far as like the bodybuilding space, the fitness space, kind of helping me to better understand that. My story, like briefly, is I had one menstrual cycle when I was 13, 14, and then I developed an eating disorder, essentially right at the same time. So, it is normal to have irregular cycles when you first have, your period. So, the first, like, when I had two cycles. That, first year was kind of like, oh, wasn't a red flag to anybody. And then almost got, just kind of forgotten about as far as a health concern that I had. And then I went on birth control for birth control purposes. Again, not understanding um cycle health or fertility. And that's why we're so, again, passionate about education and specifically, on this topic, because it's almost like, yeah, like you're saying, like it's still like, oh, you're an athlete, like it's maybe to be expected, or oh, now you've reached this level of being an athlete and lost your cycle. And kind of just messed up mind games that, young girls, are falling into. And then, we get older and it becomes, an issue again, whether or not we want to get pregnant. Having those regular ovulatory cycles is so, so, so important. So, getting into some definitions, we are going to be focusing on secondary amenorrhea here. There is secondary and primary amenorrhea. Primary amenorrhea would be a female who never got a menstrual cycle, so she never started menarche. So um in that those prepubescent years, and that's when we would be thinking maybe something like pituitary going on, like something, related to that, and growth and development. And that is a whole other topic. And the one we're going to focus on instead is secondary amenorrhea, which is defined as 3 months or longer without a menstrual cycle. So that is kind of our definition, and there are different causes. Technically, if you are on birth control and not having a menstrual cycle, not having a bleed, that's amenorrhea. There's various causes. Functional hypothalamic amenorrhea is what we tend to see the most of, which is going back to a issue where the brain is not communicating to the ovaries. And that's where that hypothalamus comes in, HPA axis, HPO axis. So that brain and ovary crosstalk is not happening for some reason. And that is why we're not having a menstrual cycle. And that, for some reason, is what we kind of want to start diving into today. Like we said, this is very common in the fitness space, and there's a reason for that.
Yeah. With regards to the fitness space, I think that something you always actually talk about, and if anyone who hasn't seen, go to Sarah's page. She actually did a really good reel recently talking about carbohydrates. And Sarah also does a really good job on her page talking about energy availability. And when we talk about energy availability, a lot of people may confuse that with, how much energy I have for the day. And truth, but that has to come from somewhere. And so this is where one of the things that Sarah's mentioned with regards to dieting can be a couple of things. So it's a balance of, and this actually is a good use of the word balance. It's a balance of the energy that you are intaking. So energy in the form of calories as well as carbohydrates and fats, and also ensuring that you have enough amino acids from proteins. But it's not just about the energy you're consuming. There's a balance between the energy you're
Spending.
what's expending. I'm like exporting.
Yeah, well, and that's like in talking about in active females, that's going to be one of the most common causes is low energy availability. And what I really want to drive home here is you can be in a state of low energy availability and be at a healthy body fat level. And I think a lot of women
Ooh, say
don't
it again.
understand that or don't realize that. And then, they think like, oh, I'm at a healthy body fat level. Why am I not having my cycle? Well, it's not just that, and at the end of the day, like kind of reeling back to that brain ovary crosstalk, the body senses a stressor, right? And it senses a stressor, whether that's under eating, over exercising, a internal stressor such as a gut infection or a thyroid issue or mental emotional stress. It senses stress, and stress again encompasses so many different things. um and it doesn't want to bring a baby into the world, right? If it thinks, there's a famine or, there's something major going on. So under eating, and not having a menstrual cycle is one of those stressors. And going back to that energy availability. So low energy availability is defined as essentially not having enough energy, enough calories coming in, quote unquote, left over to have a menstrual cycle to support fertility after we account for the demands of exercise. So you could be training, you could be eating like 2,000 calories and be thinking like, oh, I'm eating, enough, but that may not be enough for your training goals and for your body to do its thing in the gym, for your body to go about your day-to-day life, and then still have enough calories for your body to deem it, quote, safe enough to have that regular ovulatory cycle. You might be coming at 400 500 calories short. Again, I'm just throwing out numbers, but that's kind of that idea. And then you're in that state of low energy availability, even though you're like, what? I'm eating 2000 calories, or, I'm 20 something percent body fat. Like, what's going on here? And with amenorrhea, everyone's going to be so different, and genetics, your history is all going to play a role here too. But that's kind of like the overarching kind of intro to that topic.
I think that one thing that I want to piggyback on, and I actually, there's two things I think is really important, is what you said about that it's not just consuming enough calories. I think that we have a skewed view of what our body requires to function. And I think that we often come across or come about our health as giving it just enough to function. And I think that that's where there's a lot of fear about overconsumption, rightly so. And I do think that this is also where that mental part comes into play with what you said, that you could be at 20% body fat, but for whatever reason, and everybody's body is very different. And this is where sometimes what our bodies decide on is not what we prefer. And so we could be at that 20% body fat. And arguably, I'm going to say most females at 20% that are in the fitness space, they want to be leaner. I'm just going to call a spade
Which
here.
20% is lean, for the record.
Yes. Yeah, for the record, 20% is lean, but most females are like, they want to be, I'm going to say, very close to stage lean, which is not the place that our bodies thrive in. But even at 20% body fat, which is lean, many bodies are going to tell you, in the ways of amenorrhea, it does not feel safe. It does not have enough raw materials, not just to function, but like Sarah really said so eloquently. So please go back, rewind it, when she said energy left over. Because to produce or to be fertile, to house a baby, like that is an accessory. That is a bonus function. That is what we are designed to do, but that is not breathing. That is not, digesting our food. And so that is going to be one of the first things for many females that gets affected, is our reproductive ability. And I really think you said that so well, when you're like, this is extra calories that we do need.
Yeah. And the carbohydrate conversation even comes into that as well. We're still learning more about this. I said this actually yesterday in our group mentorship call, that once you start diving into some of the research, you realize like how many questions are still unanswered or just unclear as far as like how much an effect something has or doesn't have on women's health. And part of that is related to every female being different. I think not always just a lack of research. So that's my opinion. But going back to the carbohydrate conversation, especially if you are very active, being, not eating enough carbohydrates, especially around your training, or something called a within day energy deficit. So if you train in the morning and maybe don't eat right before, don't eat, after or soon after, then that still sends that stress signal to your body. So it's important to kind of think about, nutrition, and then also like quality of calories, which when you are like working to get your cycle back, you might have to be okay with, if you are somebody that eats like all the whole foods and all the nutrient dense things. This is not me saying that you need to stick to those foods. Actually, sometimes you need to actually, get some like good cereal, get some honey. Actually, honey is a whole food, but get some like fun foods like in there, like some ice cream or whatever. But for everybody, calorie quality does matter, and making sure we're getting enough micronutrients as well as macronutrients. And then also making sure we are absorbing said micronutrients and macronutrients. So working on, digestive health is also a big part of the equation in most times to restore that menstrual cycle. And that even goes back to that state of low energy availability. losing the menstrual cycle is one way that the body preserves energy. And then the other thing that it can do is it can slow down digestion, or divert blood flow, away from the digestive tract. And that impacts your gut health, and that impacts your nutrient absorption. Long term, it can lead to GI infections. So there might be some work there that needs to happen, as well.
Yeah. One thing that you brought up, but we also spoke on the group mentorship last night, and this is directly related with amenorrhea, regardless if this is post diet, post competition, post not having amenorrhea for just you're not even aware you're dieting, is time. And I think that arguably a lot of people think, for whatever reason, that if they just stop dieting, then that should be enough. Or if they've competed, it's 6 to 8 weeks after whatever competition event. This is not even just bodybuilding, but this could be like maybe you're training for Hydrox or whatever powerlifting meet. Your body does need time, because as Sarah mentioned several times here, this isn't just about calories coming in. It's about the emotional, it's about things that are happening within your life, and all of that's that allostatic load. So one thing we talked about on the call last night with the mentorship, from a case study for somebody that's been about 6 months post show, this was just talking about looking at her hormones and trying to get them in a regular place, not necessarily amenorrhea, but especially for amenorrhea. And you're probably going to be better at this than me, but I believe that where they're saying, as far as it can take a female for recovery period double the time that she was actually dieting. Would you say that that's
I would say that could be
correct?
accurate, especially if we consider that, that follicle development is a year-long process, essentially. Especially when we consider something that we've talked about, I'm not sure if we talked about it on a podcast or not yet, but your last like 3 months are kind of what is showing up in your current menstrual cycle or lack thereof. So I would agree with that, thereabouts. And giving your body that time and that space is also important, because if we're hyper fixated on healing, that just adds to that allostatic load that you were talking about. And actually, like, that is why, or one reason why, cognitive behavioral therapy is one treatment for hypothalamic amenorrhea. And it's a proven, strategy, looking at studies, looking at the research. It's an intervention that can help as far as restoring, the menstrual cycle. And that was very, very much a part of my own process. Not necessarily CBT, but diving into that emotional, spiritual aspect of health was very impactful for me to get my cycle back. Because at the time, when my personal story of getting my cycle back was post show, but then also coming off birth control, which is a conversation that we'll have at another time. But I really leaned into that emotional, spiritual aspect of things for about, I would say, like 3 months, prior to getting my cycle back. People might think this is woo, but for me, like acupuncture, doing like ice baths, like things of that nature, breath work, it wasn't necessarily the modal, like the those interventions, but it was how those interventions helped me get more in tune with myself and my body, and like the inner workings of my body. Like, what's a yes in my body, what's a no in my body, what are like ways, that I hold tension that I don't even realize it. Breathing, like if we think about like what's a stress on your body, well, if we have like shallow breathing, if we're, holding our breath, like that's a constant stress that your body's undergoing. If we're not honoring that push and pull with our training, and not really resting on a rest day, all of this stuff, adds to that allostatic load. And for me, like, unpacking that was really key for regaining my menstrual cycle. So that's why we have to look at everything that is going into that stress bucket. And I do always like to start with that energy availability conversation, because it is so common in our space, or coming off a state of low energy availability for a long period of time. Like Mare said, giving it time, giving the body time. But here again, like we have to consider everything else, going on. And it's not just as simple as eat more, exercise less. Those are absolutely ingredients, but they're not the only ones.
I definitely don't want to drag this conversation on because I think this has been a really good one, but there's something that I think that we would be remiss if I did not highlight, and that's what you said about the modalities that you brought in. I think that when we are in a position such as having amenorrhea, the approach is to fix it. And something that, again, I'm going to say rewind and listen to exactly what Sarah said. The way she phrased it was just so eloquent. The fact that she said that she brought interventions in, not because it was those things. Like, it's not that she had the belief that, I saw this person said I need to do the ice bath, and then this person I need to do grounding, and then she just stacked on all these things, and she's walking out in her yard and she's standing there and she's like, I'm grounding, where's my period? That's literally not what she did at all. Instead, she tapped into herself, her intuition. Arguably, she really rooted into who she is as a person, and just, I'm going to say, created moments of quiet. I know that some people will resonate with what I just said, some people will go right over your head, but she just got quiet. And she found things that allowed her to be present within her body, be still, be quiet, and just be in the here and the now and feel that. And arguably, like, I think we all, myself included, we can plow through life and plow through finding things to be on a mission about, especially, when it comes down to if somebody does want to, become pregnant or regain their cycle. But like, as she said, you can really wrap yourself around a pole with creating more stress where there arguably should not be. You're adding things in to fill your cup up, not drain it further. So go back, and there's so many spots on this. I'm just like, go back and listen to what she said. Go back and listen to what she said, because that's it, honestly.
Okay, you guys. Well, I'm gonna end it there then, because I want you guys to have that quiet time, and I want you to have that reflection time. If you're on a walk listening to this, try going for a walk without headphones next time. 10 out of 10 recommend. Definitely a part of my practice that I really lean on. So if you guys enjoyed, be sure to leave a review, rating, share it up on your stories. Like I said, this is episode 1 of a topic that we could branch off into so many different areas on, and will do so. And I hope you guys have a great Friday whenever you're listening to this.